Hello, welcome back. Good day today to talk to you about a problem that's not as much of a problem for our podiatry patients, but I felt like it was important that it be one of the podiatry tips that we share. Most individuals have a concern about how they should be trimming their toenails. And they ask how they should be trimming their toenails. They ask if there are changes to their toenails, if there's things that they should be doing differently, and so forth. That being said, looking at the nails, there are things that you will notice. You could have a thickening of the toenail. This can be normal. This can also be a traumatic or fungus. We will talk about those at a later date. You can have bruising to the nail from running or activities where you have a black spot or blood coming from underneath the nail. Likewise, those are situations that should be treated and should be evaluated and determine what's going on. But none of those situations should affect how the nail should be trimmed. Now, if you were to go get a pedicure, a lot of times what they will do is they'll trim the nails and they'll go back down the sides and they'll kind of work on those sides and so forth. I don't recommend that. What I recommend when you're trimming a nail is that instead of being curved like you do with a fingernail, you go straight across and then you take the corners off so that they're not pointed, but without getting it so short that when you step down on your toes, the skin comes up around and you start to get an ingrown toenail. Now, there are individuals that will never get an ingrown toenail no matter how they trim their nails, but if you trim your nails correctly, you decrease your chance of having that problem. The interesting thing about that information too is if you have other disease processes, other things that make you at higher risk for injury and so forth, it is recommended that you not trim your nails yourself. If you have peripheral neuropathy, for example, where you have loss of feeling to your toes, you trimming your toenails can cause injury and sores and wounds that can ultimately cause significant problems. Having somebody else trim your toenails can also be problematic if they have any weakness in their hands or if they have any vision abnormalities that could cause them to also cause injury to your feet or toes. For that reason, a lot of times you may need to be evaluated by a specialist to trim your simple trimming of your toenails to protect you from injury and to protect you if you are at high risk, whether you have poor blood flow to the toes or poor nerve sensation to the toes, or you're at high risk for other reasons. So when you're looking at your toenails, they should be relatively short. You shouldn't allow them to get really long because that can also cause injuries and so forth through activities. You want to trim them in such a way that you're trimming them straight across, then taking the corners off. And they should be trimmed by someone that knows what they're doing if you don't have normal sensation in your feet, you don't have normal blood flow to your feet, or your vision is such that you cannot do it yourself. So this is a relatively simple tip, podiatry tip number 6, but this will lead into our discussion for the next couple days, which is ingrown toenails, which becomes a really big problem for a lot of our patients. So trim your toes correctly and you may be able to prevent what we will be discussing tomorrow. Again, this is Dr. Brandt Gibson, and this is your